Is this real?
Yeah.
Okay, here we go.
Every year, 350,000 out-of-hospital cardiac arrests occur in the United States. When a cardiac arrest occurs, survival depends on immediately receiving CPR from somebody nearby. Almost 90% of people who suffer an out-of-hospital cardiac arrest die, making CPR so much more vital to be given by somebody nearby who witnesses a situation, because this can actually double or even triple a person's chance of survival in the situation of their cardiac arrest, according to the American Heart Association. The difference between life and death is immediately receiving CPR from somebody nearby. That's why today, I'm here to inform you all how to properly perform hands or compression-only CPR and the benefit it has not only on the person whose life you're saving, but the society and their families as well. CPR stands for cardiopulmonary resuscitation. The words essentially mean that we are restarting the heart. As most people may know, we give what are called compressions, which is the pushing in and out of the chest on the heart. We're essentially pumping the heart for someone whose heart can't pump on their own. To give CPR, you give these compressions at a constant rate. And in the instance that someone has become unconscious, has no pulse, and is no longer breathing, this is how we assess whether or not a person needs CPR or not. In the situation that you see a person, an adult, who is not conscious anymore and is lying on the ground, you now must check for their pulse and their breathing rate. To check for an unconscious person's pulse, you take 2 fingers, your middle and your pointer, and place it on their carotid artery, which is located below the back of the jawbone at the bend of the neck. You feel this for about 10 seconds. Once you've determined that they have no pulse or it is very, very weak, then you check for breathing rates. To check the breathing rate of an unconscious person, you must bend their head back at the crest of the nose to open up the airways. You get close enough so that you can hear, feel, and see if a person is breathing. To feel if a person is breathing, you get close enough to their face so that if any air is coming out of their nose or their mouth, you can feel it on your cheek. To be able to hear if a person is breathing, you'll keep their head tilted back, opening the mouth at the chin so that you can hear any wheezing or struggle to breathe coming out of the person's lungs. And to see, you remain in this position, looking down the abdomen of the victim, looking at the chest to see if it rises and falls like normal breathing would allow. See? Once you have determined and assessed that the scene is safe, you can now begin your compressions. To give compressions, you place your dominant hand laced to the back of your non-dominant hand. You place these hands with locked elbows at the bottom of the sternum of the victim. The sternum is located right here in the center of the chest. You push this at the bottom. But once your hands are placed, make sure that you're not too close to the bottom of the sternum to avoid the xiphoid process. This is a bone that attaches many vital muscles to the arms and abdomen, and if broken, can cause serious damage to the rest of the body. Now that we have our hands in the right position on the sternum, we can now begin compressions. I'll show you a few and then explain. 1, 2, 3, 4, 5. As I was practicing my compressions on the mannequin, you heard these weird pops. These aren't normal in human beings, but popping can occur when giving CPR. This popping could be the breaking of the sternum, ribs, or even the xiphoid process. Though I did say that it's very vital that we don't break this bone, it's important that even if you hear these pops, you don't stop giving CPR. Because I know that it wouldn't just be me, but my family, loved ones, and friends would be happier with me living with a few broken bones than to lose my life because somebody stopped giving me CPR. So remember to give these compressions at a continuous rate at about 100 beats per minute. You continuously give these compressions unless the scene becomes unsafe and you and the people around you could be harmed by the situation. You yourself get too physically fatigued to continue going, and it would affect your personal health. EMS arrives and decides to take over, or obviously, if the person revives and begins to breathe again. You stay with the victim until emergency medical services arrived, whether the CPR has worked or it has not. It may seem obvious to some why there are so many benefits to knowing CPR and being able to give it to someone who needs it. According to the American Heart Association, a person who has had a cardiac arrest can make an entirely full recovery when someone out of hospital has given them CPR to help revive them. It's the difference between life and death. So you can see how important it is to give CPR, even if you're not a medical professional. It's important to get certified. So now that we know how to properly perform hands or compression-only CPR, and we know the benefits that it has on society, and especially the person that we're giving it to, you can now, I hope, go out into the world, be confident in your skills, and save a life today. Thank you.